Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop Piriformis syndrome pain. But before we do that, we need to understand the symptoms, the causes, the risk factors, so the treatment plan will make a lot of sense. So before we start, we need to understand what is the piriformis muscle, where it's attached. So I can show it to you here actually in this model. The piriformis muscle is actually attached to your sacrum. So this is a back view of your spine. So we have the muscle attached in the sacrum area here and all the way to the greater trochanter of your hip, the femur bone. So the muscle is attached like this in here. So this one of the muscle is actually a very common cause for sciatica, for back pain, and extremely overlooked by a lot of healthcare providers. I will show it to you here in another image. So when you have issue with the piriformis muscle, so there's 20% of the population, the piriformis muscle, the sciatic nerve is actually going through the muscle. So the muscle is kind of a split in half instead of one piece, and the sciatic nerve going behind it like this. So 20% of the population, their piriformis muscle is actually split in half, and the sciatic nerve in the middle. And that's actually increase the risk of having piriformis muscle syndrome and sciatica related to the piriformis muscle. And you can see it very clear here. So the sciatic nerve is a yellow nerve that's going down here, and the piriformis muscle attached here in this area. So the sciatic nerve either going through the piriformis muscle, and that's caused a lot of issues for those people, or it's behind in the front of the sciatic nerve. And if this muscle is tight, or you have inflammation or a scar tissue, it's gonna compress on the sciatic nerve and cause a lot of symptoms. So you start to have spasm, tightness of the piriformis muscle. How you have this issue? It usually happens from inflammation of the piriformis muscle, scar tissue buildup, or trigger points in this area that actually compressing on the nerve. And when that happens, you start to have sciatica or sciatic pain that going down. This is extremely overlooked by a lot of healthcare providers. A lot of provider thinks anytime you have a back pain, it's a herniated disc. And the reality is most of us has herniated disc, but that doesn't mean you have a symptoms from herniated disc. And piriformis muscle is relevant really to back pain or sciatica. So symptoms, you start to have like back pain, or sometimes numbness or tingling in your legs. If you're really compressing on the nerve very badly, you start to have like the numbness, the tingling, and weaknesses in your legs. Usually patients have more pain with sitting. When you sit on the piriformis muscle, it compresses more on the nerve. So sitting or walking for more than 20 minutes, or with the intense sitting or squatting, because that's actually cause more scar tissue, more tightness and compression on the sciatic nerve. So what are the causes and risk factor? One of the causes is the split, as I mentioned to you. The piriformis muscle is a split and the nerve is going through it. And the other cause, and the main cause, is actually inflammation and scar tissue in the piriformis muscle that make the muscle tight and spastic. The other risk factor is direct trauma to the body, so any hit, any trauma to that area, overuse of in relation to excessive exercising, running, prolonged sitting, or excessive stair climbing. So, how to treat Piriformis syndrome? To really treat the source of the problem, we need to understand the normal healing cycle. So we really get to the root cause of the problem. So briefly, I'm going to go over the normal healing cycle and how to work on each of these stages. So our body has to go through 3 stages in order to heal. So the first stage is the inflammation. That's when you start to have swelling, redness, the blood start to rush to that area. And your body has to go through the proliferation stage. That's when your body starts to have a scar tissue, fascial restriction, muscle spasm, and trigger points. I'm just going to go over the scar tissue for the sake of our time, but the same process happens internally with the fascial restriction, muscle spasm, trigger point. Perfect scenario, actually, during the maturation stage, our body actually gets rid of the scar tissue and everything clear up. So why scar tissue could be an issue? Because our muscle should act like a rubber band. When it contracts and relaxes, should stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contracts, it does not stretch much. And that compress on nerve and artery and cause a lot of health issue. So for the piriformis muscle, your muscle should be nice and smooth and like moving like this. When you do any movement, it contracts and relaxes like this. So when you have a scar tissue, it's like a knot there in the muscle. When your muscle contracts, it's not going to contract much and you will start to have muscle spasm. And that knot actually going to compress on the sciatic nerve. And that's basically one of the main source of the issue for piriformis muscle. If you have chronic condition, you're usually going back and forth between inflammation and proliferation in the piriformis muscle. So how to treat it? The treatment, I'm gonna go over what is actually currently used that's not effective, so you don't have to waste your time on, and then we're gonna go over the effective treatment. So it's very common that a lot of people use like ice and stem. Ice is actually temporary pain relief for inflammation, and as you see here, it's not going to do much to the proliferation stage. Electrical stimulation is temporary pain relief, and it's not going to do much to inflammation and proliferation. The other thing that's used commonly is a foam roller. So think about it this way: if it's inflamed and you rub over it, that's going to cause more inflammation. And I'm going to go over briefly like the fascia restriction, and you will understand why foam roller and massage actually not effective as a treatment for the Piriformis syndrome. So based on the studies, actually foam roller and massage either provide short-term pain reduction or no pain reduction. So it's temporary, and it will make a lot of sense when I go over the anatomy of the fascia system in the next few slides. The other thing is not effective is stretching. And I have a video why you should not stretch, especially the piriformis stretch. You should avoid that. I had a lot of patients that actually had more symptoms from the stretch, the piriformis syndrome, piriformis stretch. And unfortunately, when you look on YouTube, it's the first thing is piriformis stretch, and a lot of physical therapists, they do that and actually cause more harm than benefit. Why you should not do that? Because think about this way: you have a knot in the piriformis muscle that's compressing on the nerve. You stretch that muscle more, and based on the studies, stretching is actually cause more inflammation. And if you start to have more inflammation, your body has to build more scar tissue to repair for that inflammation. So you actually stretching gonna make it worse with more scar tissue. And the other issue with the stretching is you stretch the knot, that's gonna send the feedback, a negative feedback to your brain to have muscle spasm because you cannot stretch much, and will cause more symptoms. So it's gonna cause more harm than benefit. Please do not do piriformis stretch. The other thing is strengthening exercises. I introduced that in the right time. There is much more effective exercise than the strength exercise. We'll go over that in the next few slides. But if it's inflamed, you're going to make it inflamed more with the strength exercises. So what we should do for Piriformis syndrome? We need to look at the healing cycle and really address it from both ends, the inflammation and proliferation stage simultaneously. So for inflammation, if you are in mild inflammation, acute stage, basically resting 5-7 days, that should be enough, and avoid the stuff I'm gonna go over in the last slides here. That's a mild inflammation. For moderate to severe inflammation, what I personally use is using the Magna Heal 2 and the range of the magnetic field is about 3 inches, so actually can go deep 3 inches in the body, and that's what I use in the piriformis area. Just put it right on that area to decrease the inflammation. At the same time, I actually put my patient on anti-inflammatory diet because some food is actually cause internal inflammation in the body. If you are in a moderate to severe inflammation, chronic inflammation, there is very high chance you might have vitamins, mineral deficiency, or hormonal imbalance. Why that could be an issue? Because your body, for example, need D, magnesium, zinc, other vitamins and minerals to transition from inflammation stage to proliferation stage to maturation stage. And if you have those deficiency, your body's not going to transition to maturation stage. So if you are in chronic condition that your body going back and forth between inflammation and proliferation, make sure you figure out what is the deficiency you might have. One of the easiest way to do that is Ask ASTR. AskASTR.com. It's a free online software that will help you to figure out if you have vitamins, mineral, or hormonal imbalance, possibility of deficiency, and what kind of steps you need to take. So the software it takes about 5 minutes, and it has at least 9 healthcare provider database. It's very comprehensive and it's free. Take advantage of that. So the other thing we have to work on simultaneously is the proliferation stage. So what I personally do is working on the scar tissue, trigger points, and the fascia restriction. So I use the A3 to work on breaking the superficial scar tissue, and I use the A5 to work on deep scar tissue, trigger point, and fascia restrictions. So that's why I said the foam roller and the massage impossibly to release deep adhesion, because what we learned in school to use the knuckle or the elbow to really go do deep release, but it's mechanically impossible to go deep in the muscle with your elbow or knuckle. That's why I invented the A5 to really go deep in the piriformis muscle. And I have it in, like, some patient actually we can go deep like 2 to 3 inches in the piriformis muscle to really do deep release. And think about this way, if you have a screw that you need to unscrew in your motor in the car, and you have the screwdriver is very short, it's impossible to unscrew that. You have to have a long screwdriver to really get deep. And for fascia restriction, muscle spasm, or trigger point and scar tissue, if you do not have mechanical force on the restricted area, it's impossible to release it. That's why the foam roller and the massage are not effective to really work on it. The other thing we need to understand, and I go into detail, is the fascia system. Briefly, I will cover that here, because when you understand that system, you will appreciate the treatment. It will make a lot of sense. So the fascia, the superficial layer, it's like a wrap surrounding the entire body. That's a superficial fascial layer. And you can see it here in the image, the yellow web tissue in here. That's the fascia layer. The system extremely complex, but the treatment very simple. And I want you to go over some of this complexity to really appreciate the treatment and understand why we should address all the layers of the fascia. So the fascia system is divided to 2 subcategories: superficial fascia and deep fascia layer. The deep is actually divided to 4 subcategories: apparetic fascia, epimysin, premiysin, endomysin. Apparetic fascia wrap a group of muscles. The epimysin wrapping individual muscle fiber, as you can see here. The premiysin wrapping a group of bundle of fibers, you can see it here. And the endomysin wrapping each individual fiber. So each of these layers is actually consists of 2 to 3 sub-layers. Apparetic fascia, you have 2 to 3 epimysin, 2 to 3 premiysin. That shows you how complex that system, and you cannot pick and choose one layer and leave the other layer to release. That's not a complete treatment. And that's why it's impossible with hand to go to all these layers and release it. So what I personally do is using the A1 to release the superficial and the apparatic fascia, and I use the A5 to work deep to release the epimysin, premiysin, and endomysin. So to sum it up, what should we do for the Piriformis syndrome? Well, the first thing is if you putting a wallet or your phone in the back of your bucket, make sure you remove it, because that's too much pressure that's gonna cause scar tissue and pressure on the piriformis muscle, which actually gonna push on the sciatic nerve. The other thing, we need to do core stabilization, and I have other video focusing on that, how to do core stabilization. Proper posture, especially sitting and standing posture. And for the people who has severe, moderate to severe chronic Piriformis syndrome, I recommend you actually break the vicious cycle from both ends, the inflammation and proliferation. Remember, stretching gonna make it worse. So we need to work on the proliferation stage. Majority of the Piriformis syndrome patient, they have excessive scar tissue, fascia restrictions that actually cause the piriformis muscle to be tight. It's by definition here. It's inflammation, it's a buildup of scar tissue, trigger point, it's a lot of tightness. Strengthening and stretching will not break that. You have to have mechanical force to release that. If you don't have the mechanical force, it's impossible to release it with the stretching or strengthening exercise. So that's actually how to treat Piriformis syndrome. So if you have any question or comment, leave it in the comment section below and I will answer it in the future video, and I will see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.